I chose the profession of being a physician because I really wanted to work towards impacting patients' quality of life. So when I first thought about what I wanted to do, I was very interested in medical research. I worked in a lab and did a lot of experiments. I loved the technicality of that and the organizational aspects. But I ended up doing some Hurricane Katrina relief projects. And that is what really inspired me to pursue a career in medicine, because I wanted my work to impact the lives of people. The reason that I chose ears, nose, and throat was because I wanted to work with adults and children. I wanted to do work in both medical management and surgery to improve people's ability to communicate, to have just a better sense of their day-to-day, not be dealing with chronic sinus issues. And then I ended up pursuing rhinology because I have an interest in treating patients with chronic sinusitis. Yes, so that was when I'm going to be dating myself a little bit here, but I was in undergraduate, and I went to Indiana University, and I heard about the hurricane, and I just felt like very compelled to go down there, and I don't know exactly what triggered that decision, but it was during my spring break, and I just felt like I wanted to do something where I could work in a group, and it was manual labor. So I did 3 different trips. The first trip we were kind of like doing more of like the clean out, and so we had to wear like all the gear for mold and whatnot, and we were actually like removing drywall. I had never worked with any of these power tools, so that was a really cool experience. And I really loved working in a group environment, but my favorite part was when I went back for the 3rd time. I got to see a house that I had worked on my first trip, and meeting that family it was just really one of those moments that just makes you realize why you're here and what you want to do. And it was just so amazing because they were so joyful. They did a crawfish broil for us, and it was just so special. I'd never experienced that kind of hospitality before. Oh, yes. I mean, I think I tend to be more personal with patients. I'm not treating a symptom or a disease process. It's really important for me to put all of that in context with the patient and the individual. So that kind of goes into my patient philosophy and treating. It needs to be right person, right treatment, right time. So, really trying to figure out what's going to work the best for that individual. A lot of it is a combination approach of using medical management, which as the ears, nose, and throat, we are experts in treating disease processes of the ears, nose, and throat. So, usually we're starting with medical management and then potentially a surgery. And so that's one of my favorite parts of this profession. It's just, seeing patients, trying to figure out the best treatment plan for them and taking them through that. So I am so fortunate. I feel very blessed that I was able to find this group. So I was actually living in Milwaukee, Wisconsin, and that's because I did most of my medical training there. And my husband was recruited here, and at first I felt a little bit lost, and I wasn't sure exactly where I was going to be. And then one of the physicians contacted me, and it was really from that moment forward that I just felt, it was like a huge weight had been lifted off my shoulders, and I felt like this was definitely the right place for me. I feel very fortunate with the area of ENT that I do. I get to follow patients kind of long term, because it's not just about doing a surgery. They require more medical management. But in some instances, we do surgery, and then they recover, and they're kind of good to go. So, for example, I do minimally invasive skull-based surgery. So I work with neurosurgeons to remove pituitary tumors through the nostrils. And so that is one example of a particular patient scenario where patients can be apprehensive about it. When you think about going under a process to remove a brain tumor, but thankfully we have these techniques where we're able to access the brain from the nose. And so those are some of my favorite cases to do. It's just a different type of anatomy. It's basically like doing sinus surgery, but we're able to reach parts of the brain. The patients are able to go home after a few days. And so it's really awesome to see those patients back and follow up, and they seem just so thankful that we're able to approach these skull-based tumors in a way that is less disruptive to their day-to-day